Hi, my name is Dr. Nin Tran. I am the Program Director for McMaster's Public Health and Preventive Medicine Residency Program. Welcome to our webinar.
My name is Dr. Thomas Piggott, and I'm the Chief Resident of McMaster's Public Health and Preventative Medicine Residency Program, and I'll be narrating the webinar today. In this webinar, we're going to share all about what residency in public health and preventative medicine is really like. We're also going to talk about McMaster's program and what's unique about our program, as well as address questions such as living in Hamilton and other ones that we often get. We hope you enjoy the webinar, and please feel free to reach out to us if you have any questions or concerns at the end. So, if you found your way to this webinar, you're probably at least somewhat interested in public health and preventative medicine. Sometimes it can be tough to find out a lot of information about public health in medical school, which is often very clinically oriented. But public health and preventative medicine training actually focuses on the health of the whole population, not just the health of individuals. Public health and preventative medicine doctors, or PHPM doctors for short, do a whole variety of activities. They can work anywhere from a more clinically oriented field with a public health perspective to the local, provincial, and national level. As a public health and preventive medicine specialist, you might expect to do activities such as those listed here, including responding to communicable diseases, addressing healthy living, advocating for policy change, planning for emergencies, and reorienting clinical services to be more focused on populations and prevention. Here are just a few of the career activities you might expect to do as a PHPM doctor. As I mentioned, they often work in different settings: regional, local, federal government. Preventative medicine doctors can also work in occupational health, sexual health, or travel medicine, NGOs, internationally, in research, or in education. PHPM training can be best thought of as divided into three parts, each of which is linked and focused on making you the best PHPM doctor you can be. The first part is often clinical training. That's a minimum of a year or 2 years if you want to complete family medicine training. Additionally, you will complete academic training, which is often leading to a master's degree, such as a master's of public health or a master's of science. Finally, you'll complete between 1.5 and 3 years of public health placements. We'll talk a little bit momentarily about the public health placements at McMaster. So now we'll talk about McMaster's program in particular. We'll address questions such as what's the program like and how is it organized and what will I do? If you're interested, you can reach out to chat with one of the residents or try to attend an academic half day. Our residency program can be thought of as having two different pathways. One involves the addition of family medicine, while one focuses only on public health and preventative medicine. Both positions are accessible from international medical graduate or Canadian medical graduate positions at this current time in 2018. One aspect of McMaster's training that is unique in terms of the structure is its integrated approach. That means that we have a non-sequential pathway through the three components that I already discussed about the program. It has a lot of advantages, including providing more longitudinal training in both public health and clinical work, and allows for stronger connections as you feel connected to the public health program throughout the 5 years of training. Here's a graphic describing the traditional structure of public health and preventative medicine training programs. And now here's a sample training pathway of what your residency at McMaster in PHPM could look like. This sample pathway 1 includes the addition of family medicine training. Sample pathway 2, shown here, does not include family medicine training. Instead, it allows for more time in academic or public health rotations. The choice of which pathway you pursue is dependent on your own career objectives and training needs. Whether or not you pursue family medicine training, your first year in PHPM at McMaster looks the same. You'll begin with an Intro to Public Health rotation, which will occur in one of your first few blocks or months of residency. You'll also complete rotations in pediatrics, internal medicine, OB/GYN, maternal and child health, emergency medicine, geriatrics, medical microbiology, and additionally have the opportunity to complete electives in either clinical or public health disciplines. Here are a few pictures of the internationally renowned teaching hospitals where you will likely complete some of your first year residency training. We are additionally linked to a number of top rated family medicine training sites. These include McMaster Family Practice and Stone Church, which are both large family health teams based in Hamilton. Additionally, there's the option to pursue community based residency training in a smaller family physician's office. Residents in PHPM are encouraged to pursue a rigorous academic training program, such as those listed here. The specific program that residents choose to pursue will be discussed with the program director upon admission to the program, and usually begun in the PGY2 year of training. At McMaster University, in order to complete the Royal College requirements for PHPM training, the following on this slide demonstrates the blocks of public health rotations that residents will complete. These include core rotations in communicable disease control, environmental health, chronic disease and injury prevention, policy and planning, senior management, as well as a number of elective rotations. The public health rotations that I just mentioned can be completed at a number of sites that are affiliated with the public health program at McMaster University. These include the core public health unit sites of Hamilton, Waterloo, and Niagara, as well as a number of other sites which we have close ties with. Residents can also complete rotations at provincial, federal, and international government levels. A number of other sites are also possible, depending on your learning needs. Here are a few examples that residents have pursued in the past. Longitudinally, throughout the PHPM training program, you'll attend academic half days with your co residents. These operate on 2-year cycles of content that cover off the core training requirements and topics to become Royal College certified in PHPM. Academic half days are a great way of getting exposure to a variety of public health topics and a variety of experts in public health and preventative medicine, not to mention a great way to network and catch up with your fellow residents. So, have I sold you yet that McMaster's the place to come for PHPM training? Well, if not, here's a few more reasons to think about. Our program is not too big and not too small, and very flexible to the individual training needs of residents. The integrated pathway brings with it a lot of benefits, including allowing you to explore multiple topics at once and learn to balance multiple needs, which you'll need to do as a PHPM doctor. Additionally, family medicine training is a great complement to public health training. Finally, Our educational funding is top notch and allows you to pursue conferences on public health topics of your interest or other educational activities. McMaster University is an internationally renowned research institution. Additionally, the city of Hamilton is a wonderful place to live and work. Here are a number of the activities and topics that are unique to McMaster and the Hamilton area. We at McMaster are internationally renowned as a research institution, including known for the development of evidence-based medicine and its important applications to public health work. Additionally, as I mentioned, we have a wonderful mid-sized residency group which allows for a great community to grow and learn within the public health field. Oh, the Hammer. Hamilton's a wonderful place to live and work. While it used to have a worse reputation, it is now one of the top growing and most desirable cities in the country to live in. Hamilton has a wonderful art and restaurant scene, including a lot of other cultural activities and festivals. The area surrounding Hamilton is also an area of outstanding natural beauty, including lots of great hiking and opportunities to explore. Don't miss our mouth-watering restaurants or the wonderful Hamilton Farmers Market, located just steps from our Public Health and Preventative Medicine residency program building. So, I've got you hooked on Hamilton and McMaster University for PHPM. Well, how do you get here? If you're listening to this webinar, I'm guessing you've probably already heard of CARMS, the Canadian Residency Matching Service. If not, you'll want to check out carms.ca. Please note that on this website, you can see a list of our current requirements for applications to the residency program and information about both Canadian medical graduate and international medical graduate spots. It's worth noting here that IMG applications are highly competitive and we receive a number of applications every year. As such, the thresholds for interviews on exams such as the NAC OSCE and the MCEE are changing year to year. IMGs are also assessed on their recency to clinical training in order to allow them to succeed in the clinical components of the training program. While we can't share the exact approach that we use to pick candidates to interview, we consider the following factors, and these will be things you'll want to consider too. Understanding of public health and preventative medicine. Do you show that you've had good exposure and can really understand what PHPM doctors do? We'll also want to consider your suitability for family medicine training, your academic performance, including past and future potential, your communication skills, and the reference letters that you provide. Where will residency in public health take you? Here are just a few of the individuals who've graduated from our program over the years. As you can see, PHPM can take you a whole number of places. So that brings us to the end of the webinar today. Thank you so much for listening, and we really hope that you'll consider joining our program and our wonderful group of residents in Hamilton, Ontario at McMaster University's PHPM program. Bye-bye.